Hello, everyone. Welcome to the RoK Diagnostics Podcast, where we delve into the world of healthcare, exploring innovations that are transforming healthcare across Africa. Today, we're thrilled to have Oluwasoga Oni, the CEO and co-founder of Mdaas Global, the company behind Nigeria's fastest-growing healthcare network, Beacon Health Diagnostics. Since its first center was created in 2016, Mdaas has expanded to 17 locations, covering 25 states across Nigeria. With more than $6 million in global investment and having developed proprietary technology platforms like Beacon OS and Beam, MDAS is on a mission to provide quality diagnostics to underserved communities and reshape healthcare across Nigeria and probably across the African continent. So thanks a lot for being here with us today, Oluwasegun. How are you doing?
Pretty good, and thanks for having me.
Thanks for making the time. It's nice to meet you. I think it's about 2 weeks ago, doing some research into the Nigerian market and diagnostics when all of a sudden I stumbled on your company, which is essentially something I thought we should always have. So it was nice to see that it's something that's already being done and that is at such a level. So why I thought it would be interesting to have you on the podcast and discuss exactly how you got to this level and also what the future might look like. So, really quickly, for those who are listening and who may not know you, could you just quickly present yourself?
So thanks for having me on the podcast. My name is Oluwasoga Oni. I'm Nigerian. I'm a systems engineer. Launched and started MDAS in 2016. And been doing this work since then. One of the things that, as you can imagine, I'm not a doctor, I'm not a medical lab scientist or a radiographer or whatnot. But I did come from a family of medical doctors, so everybody in my family works in the healthcare space. But I was an engineer, right? But after I studied systems engineering, and I was looking for my next step at that point. One of the things that attracted me to the healthcare space was the fact that a lot of the problems that you tend to see in the healthcare space are actually systems problem, the health systems problem, the systems engineering problem, pretty much. And so when I looked at the diagnostic space in Nigeria and across Africa, we see pretty much the same sorts of problems. And so, and that's what motivated me to start a business to kind of solve that problem. And I would say that we still have a long way to go, but I think from, when we started, we've come a long way also. So right now, like you said earlier, we operate a network of I think 18 locations now across Nigeria. We also work with partners in states where we don't have a presence, so that gives us coverage on all 26 states in the country. We're probably the largest network of diagnostics in Nigeria. We work with everybody. We work with all the top HMOs. We work with over 40 HMOs, health insurance for the people who don't understand. We work with a lot of corporate partners. We work with over 100 corporate partners and employers. We also work with over 1,000 hospitals across the country. So we're one of the largest networks of diagnostics in Nigeria today. And we started to think about what the next stage is for us, which is expanding outside Nigeria. So this conversation came at the right time for me.
Now, one thing that I was really surprised by was I saw, well, so 2016 till now, it's not that long. So the speed at which it's been going has been really, really fast. I guess there was a lot of motivation to really start this. Now, where's the motivation right now after maybe 8 years? Is it lower? Is it the same, or is it even higher than it's ever been?
So the motivation is higher than ever before, just because when you start, you don't know what you don't know, right? So you just kind of stumbled around, trying to understand. A lot of what we're trying to get is an understanding of this landscape, right? But at this stage of our evolution, right, we fully understand the landscape, so we know what we need to do to be where we need to be. When we started, we didn't even know what we needed to do to be where we needed to be, right? But now we know what
Uh,
we're not where we need to be, but we know what we need to do to get there. So because we know that now, we have a lot more information. we're very motivated to go and do it. And it's not like there's no obstacle. Obviously, money is still going to be a problem, regulatory is still going to be a problem, but we know how to get, we know how, we've solved it before and we can keep solving it, right? And so that's the way I
Yeah.
see it. And so we highly motivated. We want our big vision at MDAS is providing health care for Africans next billion, right? So we want to build an organization that over the course of the years will provide healthcare for 1 billion people, right? So, and my our near time goal is like we want to be able to serve 1 million people in 1 year, right? But right now we're serving this year now we'll serve over almost 200,000 people this year, right? So we're not at the million a year number yet, but we're at 200,000. So we
Great.
can we know we see the goal and we know that we can hit it. Yeah. So yeah.
Yeah, it's really inspiring, encouraging. But how are you able to stabilize things? Because I'm assuming growing really fast it might also cause problems, cause issues. So how are you able to balance both the growth and at the same time keeping everything stable so that it doesn't go in whatever direction?
Yeah. So we've grown really fast. So for them, just to give you a brief context, so this year, for example, we've built 4 locations in 1 year. I think the max we've done in a year is I think six, where we did six
Uh,
locations in a year, right? So when the years are sometimes when you look at our evolution, right? We launched our first center. Actually, when we launched the first center was in November of 2017. Uh, and then we launched that first center. We used that to understand the business, and then our second center was actually launched in I think 2019. Second center. So we ran the first centers for over a year before we launched our second center, right? Um, and then we ran that too for some time before we went to the next phase. So we built in phases, right? So we're currently in a build phase right now where this year we'll probably build 6 or 7 locations this year, right? So we're in a build year, so everything else is yet to build up. But what helps us do this is because there's a method to our madness. We are mad, but there's a method to the madness. So we have systems in place. So
yeah.
for us, for organizations like us, whose job is to build and operate, this sort of diagnostic networks, what was more important was creating all of the processes at the beginning. So when we started, we didn't just start and say, let's go build something centers. We started with one center and operated it for a long time. Did another center, operated it for a long time. Did another one, operated for a long time to build all of the processes we need, right? And now we have technology. We built our own bespoke tech to run our centers. So now when we launch a center, right, it's just like a checklist. Do we have this? Check. Do
Okay.
we have this? Check. Do we have this? Check. Do we have this? Check. Because we know everything. So there's a system to the madness. So that helps us build fast. That helps us like expand really, because we're not guessing, right? We know what we know, and so we just like we've operationalized all parts of building to the point where it's just like we can give me 3 months, I'll build a center. Like is that easy?
Okay.
Give me 3 months and some money, I'll build a center. So
Yeah. So you've been able to systematize things well enough that it's a lot easier today. So when you say you have checklists, so I'm
yeah,
thinking it's
exactly.
a bit similar to maybe so it's a bit maybe similar to like restaurant chains where some of the parameters they'll take into account is maybe like the location and maybe something like foot traffic, maybe income of people in the area. Are there similar factors that you also take into account, maybe number of hospitals that are around and that sort of thing? What's the most important according to you?
Yes. So for us, location is the most important. The location is very important because if you, for example, every city that you go to in Africa, most cities will have an enclave of the city where people go for healthcare services, right? If you go
Yeah.
situate your center in a place where it's not part of that enclave, then nobody knows that your center exists, right? So you need to understand the lay of the land to understand where you need to put your centers. Um, But that's not the only question. We've gotten it wrong a couple of times, and the center still was still okay because what we needed to do now is convince people that I'm high quality enough that you should come to my center, right? But it just means that you might lose. It takes maybe one more year for you to succeed in the place, rather than if you get the location right the first time, you don't need to worry about that. You understand what I'm saying? So for us, as
Yeah,
someone who, of course, we've done different centers, we've made our own mistakes and whatnot. We don't now we know what we need in the center, in the location of the center. That if it doesn't fit our needs, we just don't do the center. It's not. We don't have to we wait till we find the right solution, the right location for the because it's such an important decision as a retail organization,
yeah,
right? And then there's other parts of the of this too that it's not just about the location too. It's also about like the density of the population of the place. Are there enough people there? If you go and put a five-star hospital in a village, nobody will go there, obviously. So like making sure that the demographics of the place, seeing what the healthcare systems already do. So we don't seek to replace what happens before. We actually seek to enhance the healthcare system. So a lot of when we think about setting up, we're thinking about understanding the healthcare system in a place in such a way that we can enhance it. So, for example, if you go to a place and see that one particular kind of diagnostics is not being done in that area, we might say, okay, in this center, let's introduce this to them. You understand? So we like to
yeah.
understand the ecosystem of the place we're going to well enough so that we see how can we provide value in this place. So yeah.
Okay, I get it. So that must have helped also a lot with stability. Because from what you're saying, I think one of the things you've been doing also that some other startups sometimes find hard to do is first analysis, then patience and self-control. To not just jump into any opportunity, but choosing the right opportunity. Although you want to go fast, you still wait to find the right opportunity before you actually get into and make a final decision.
Yeah, and to be fair, sometimes people jump into opportunity and there's a banger, right? Right? So,
Yeah,
but I
true.
think that healthcare is such a very specific industry because you're dealing with people's health that you have to tread a little bit more carefully. We're not like just building software, right? Where you can move fast and break things. If you break someone's health, they will come for you, right? So you have to we have to be a lot more introspective when we're thinking about setting up in a place to say, okay, can we actually provide something interesting, something better in this space? And oftentimes the answer is a yes, just because the state of healthcare in many parts of Africa is really quite poor, right? So yeah.
Yeah, that's true. Now, one thing I'm also generally interested in is business, and so of course, since I'm in healthcare, also the business of healthcare is also important. Now, most, pretty much all kinds of healthcare institutions tend to be resource heavy investments. Now, you got some investment in order to be able to start this. Now, what was your approach to pitching? Because there might be some people who are watching this who have some ideas, interesting ideas in the healthcare sector, or even in other sectors, who don't necessarily know how to pitch their ideas. What do you think was the most salient part of your pitches that was really able to capture your audiences, or that was really able to capture the attention of potential investors?
I think so. I will give a caveat before I answer this question to say that the investment environment in Africa has changed in the past 2 3 years because of the global trends in funding. So Africa don't get as much money as they used to get as we used to get before. Number two is that a lot of African economies are going through a lot right now. So that means that the case for an investment is harder to make than it used to be, right? But that being said, I think in the end, when you're pitching, it's about like the people you're pitching to are not charity. If I wanted to do charity, an NGO, right, it's going to be totally different. I'll be pitching to all different set of people. So understanding that the reason why people will give me money is because they think that there's an opportunity. So
Yeah.
you must be able to showcase that opportunity to potential investors. And for me, when I sometimes hear people pitch around um, solving problems in healthcare, I usually have them. A lot of people tend to pitch from a place of African is poor, right? Oh, I want to help these poor Africans, um, and it makes for a good story. And there's nothing wrong, if it works for some people, it works for the charity people, right? That, oh, please give us money, but it doesn't really work for um, investors. So, and it doesn't take away from the fact. So, pitching the opportunity doesn't take away from the fact that a lot of Africans have lower income than the rest of the world, but that there's an opportunity um, to make financial returns and improve people's lives at the same time. I think that that's something to say by deploying your capital to someone like me, you're more likely to improve some like the lives of people across Africa than
Mm.
giving it to a different cause. So you need to be able to showcase the opportunity of Africans, not just say Africa is poor. Like, please help me. It's about being able to paint a picture to say, look, there's an opportunity to build something compelling, something that will impact a lot of lives, but something that will also give you a financial return, whatever that may be. And if you're able to do that, then you will be able to pitch. And then the other thing for us is that yes, we actually have raised about $7 million or thereabout. And one thing about the funds we've raised is that we didn't really raise it all at once. Right, we raised a little bit of money. Showed the first big fund we raised was family and friends, was maybe like $22,000. We showed enough traction to raise the next round. Then after the next round, we showed enough traction to raise a bigger round, and then we showed the traction to raise a different round. So it's not like you go out and just say, "Give me money, give me money." You also have to be able to. You need a track record. And when people see someone with a track record, it's easier for them to give you money because they can talk to your previous investors to say, "How has it been? Has it done well? Is he doing what you expect him to do?" And if they can back you, then you will be golden, right? So yeah.
Yeah. Yeah, true. I guess also in some cases the innovation can any innovation that you can bring in can help. So I guess in your case, since now you have proprietary technology, now it's also should be getting easier to convince people to invest in you because not only do you have the operational track record
So
on the
I would say,
innovation side.
I would say. So what I would say with the innovation side is that, like, particularly in the healthcare space, is number one, it's still about the impact you're going to make. So, for example, my patients don't care about digital health. They don't care about technology health. They don't care about, like, tech-enabled health. They just want me to
All
do their
right.
malaria test. How I use
Yeah.
technology is my own business, right? They just want to get better. So it's about showcasing, like, if you have a technology that obviously is enabling you to reach more people, to do more work, to improve your efficiency, that's amazing. And you can showcase it, and we do showcase our tech. But understanding that in the end, it's not. I see a lot of very innovative companies who have no customers, no traction, right? So it's not about just
Yeah.
creating an innovation or something in compelling innovation. It's about being able to show that your innovation is actually driving real traction with your business. Because you can go invent a new medical devices that nobody have seen before that does a lot of work, but if you only have five people using it, nobody would want to give you money because you need to prove that people would want to use it. So, so it's important to actually build stuff that people want. So,
Yeah.
so yeah.
Now, of course, to achieve your goal of spreading over, let's say, to all of Nigeria and, of course, across Africa, you need a lot of human resources. Now, with many Nigerians and I'd say largely also Africans looking towards trying to leave the continent, what are some of the, how do I say that? Some of the reasons you can give them for staying. How are you able to convince some of them more some of those you want to remain to actually stay so that they can help with that whole process?
Yeah, I will be very blunt. You can't convince someone that wants to leave to stay. You can't, right? And you can't, also because like the reimbursements in for healthcare, like so paycheck in the UK is like insane compared to a doctor's paycheck in Nigeria. So if someone is meant on leaving, they would eventually leave if they have the right things. But what you can do for
Yeah,
yourself is, so you can control that. You can control someone that wants to, you can't really convince them to stay either which ways. But what you can do is you can control how it affects your business. So by building a pipeline of people, you have to understand that yes, a lot of Nigerians are trying to leave the country. A lot of Africans want to go to Europe and the US and other places. But guess what? There's still a lot of people that are going to stay, and someone has to provide services for them. So finding local people that are, I think for me, building a pipeline is more important. And finding people
okay.
locally who are committed to staying, who maybe because of family reasons um, or condition, or just their financial conditions are still going to be in the country for a while. You work with those people, and when they tell you that they're going to leave, you take someone from your pipeline and replace them. But it's a problem that all healthcare businesses face, at least particularly in Nigeria. I know that a lot of doctors are leaving. It's very, very difficult to hire a doctor now than hire a doctor like 7 years ago when we started. It was easy to hire a doctor back then, but now it's ridiculously difficult to do that. And even the
Yeah,
government is struggling to hire doctors. That's how bad it is. Not to talk of like the private organizations, right? So it's a
yeah.
challenge you have to face. You can control the way it affects your business, but you cannot really prevent people who want. It's just this is the situation. Yeah, right. So yeah.
Yeah. And so there's a pool of doctors that has to be shared by lots of different centers. But then I guess the fact that you, in your plan, in your model, you don't just have your own centers, but you also have affiliates. I guess that also helps a bit, especially with spreading more knowledge
Yeah,
about
and
you and what you do.
yeah, and then and that's one area that tech can really help, right? Where you can do like, so for example, we do thousands of screenings every month now. We do 5,000 healthcare screenings, annual screenings for people. And each of these annual screenings would need a doctor to review it, right? 5,000 people for we have doctors employed, but 5,000 results to review is a lot of results, right? So we've expanded that pool to like contract doctors, people that work that will just come review results. That's one area where you can actually use technology, right, to bridge the gap where you are doctors are able to do remote diagnosis and review things remotely and stuff. So that's one area that you can use technology to bridge the divide, where even though you don't have that doctors hired in your organization, you can still access to doctors who are willing to work with you. So yeah.
Yeah. So remote diagnosis, yeah, that sounds. I was wondering, in Nigeria, how is the internet connectivity aspect working? So I know that in Benin, for example, laboratories sometimes when you come to the solutions that involve using the internet, it's sometimes hard to convince them to work with you. How has that been in your case in Nigeria?
Because we control our labs, all of our labs are internet connected. All of everything, all of our diagnosis centers have internet. Because like I said earlier, we actually run on our own software, right? So for example, as I speak to you right now, I can tell you how many people came to my center today. I can tell you what they came for. I can tell you I have all that information, even though I'm not presently in Nigeria, because everything happens via our tech, right? The way we issue our
Yeah.
results. If you came to our center right now, if your corporate partner sent you, if you came for a pre-employment screening and the HR department is waiting for your results, the result goes to the HR department automatically. We've digitized all of the workflows for
Hmm.
diagnostics pretty much, right? So
Yeah.
everything happens
Yeah.
quite seamlessly within our ecosystem, right? And
Yeah.
that's because
In your
all of our
case,
centers are connected to the internet. So in like,
yeah, that's what I had assumed for your centers. I mean, for the
go ahead.
affiliates.
Yes. But the affiliates too, everything because when they do work for us, they need to get paid, right? So they have to send us results,
Yeah.
and that also happens all remotely. Uh, but for them, not all of them are
All
digitized yet, right? But right now we are building tech for them to digitize them.
right. Okay.
But everybody
All
will
right.
have access to
So,
like a data to send results to, because if they don't send us the result, they don't get paid, right? So
mhm. Okay, I see. Now, in your case, when the you have this large network and the data comes in, generally, what do you use the data for? Is it for public health initiatives? Is it for, like, do you have contracts with the government? Is the government coming towards you to ask whether they can use that to help with the healthcare ecosystem? Are non-governmental organizations that are in touch? How does that happen? Is there any research around it?
So that's a great question. So right now we do generate a lot of data, right? Like, every day 500 people come to us for all kinds of stuff. So we have a lot of healthcare data, um, both operational data and clinical data, right? A lot of what we've done so far is doing more, using the operational data to just drive our business, to understand our business more, to improve our supply chain and whatnot. But we've not
Yeah.
done anything with the clinical data yet. And that's one area we can work with the government on. One of our future plans is to um, write quarterly papers on what we are seeing in our data. That's one of the things we'll probably start next year. We'll start doing quarterly public health because we want to be known as publisher of really great data on public health in Nigeria. So that's something that we'll start doing
Yeah.
early next year.
Okay, yeah, that's always interesting because that's one thing we've been missing the ball on in many of our countries. We have so much data coming from healthcare centers, laboratories, but either it's on paper or if it's collected, it's not really used for anything. So that's really something that's we need to work on a lot more. But you just
Yeah,
quickly
but
talked
but you
about
have to think
supply
about it this way. For me,
chain.
so for me, you have to think about it this way, right? Like, so I have all this data. Like, to create my own software cost me millions of dollars, right? To build
Mhm.
that system, to make it operational, to be at a point where I can collect this data and stuff, cost me a pretty penny, right? But I want to be able to contribute that data to the public good for the public good. But do I get any incentive from the government to help me do that? No, I don't. Did they reach out to me to say, "Hey, Lisa will support you" and stuff? No, they don't. Right. So that's the thing, is that there
Yeah,
needs to be something in it for folks like. So for us, because we want to be seen as like um, an organization that is progressing public health, which we are doing. So we want to be able to um, give our own insights on our data. So, for example, there was a cholera outbreak in Lagos a couple of months ago, and when we look at our data and see what test people were requesting, right, we realized that the cholera outbreak wasn't just around Lagos, right? It was across the southwest of the country,
okay.
right? But like
Yeah,
we could see that in our data, and that's something that we could, we'll be able to say, hey, maybe this is not just bucketed into Lagos. This is across. We're seeing people request more stool MCS across the country. Across these are the places where people are requesting more stool MCS. So you guys should also take a look at that, right? That's the kind of things we want to be able to do.
all right. So I think we're getting towards the end. There are so many
Yeah.
questions I could have asked because you've been growing so fast. But where do you see the company going in the, let's say, next in the coming years? Of course, you have this plan to reach 1 million people. Aside from that, where do you see yourself being in the coming years?
So I think that for us, when we look at what our superpower is, right, as an organization, is that we figured out how to scale clinical infrastructures, right? That's a superpower of an organization, is that we figured out how to scale clinical infrastructure. And so we want to be able to take this to as many places as possible. I feel like that's very important to us. I think when you compare the quality of healthcare in many African cities, it's actually quite poor. People diagnosed to clinical science mostly, They just see you and I think you have malaria, and then they just start treating you for malaria. What about if it's something else? What about if it's yellow fever? So people don't. So we want to change that paradigm, right? So that means we need to expand our operations, not just in Nigeria. We're currently looking at Cameroon. Benin Republic is a place I would love to come to. We're looking at Ghana. We're looking at Ivory Coast, Senegal, to say how can we scale our work past what we have today to other places. And so that's something that's interesting
Yeah,
for us. And we have, when you think about diagnostics, right? You need a few things. You need access to capital. You need technology for workflows. You need the clinical staff to do the work, and then you need coordination. And in all of these things, maybe the only one we don't have right now is access to capital, right? Capital to scale. But all of the other ones we can do, we know how to do it. That's our specialty. And so and capital is, we can figure it, we can eventually figure out capital, if our numbers are good. So there's nothing that says we cannot be in every single country in West Africa in the next 5 years. There's nothing that says that we can be the first organization to have a branch in every West African country. We care so much about West Africa because when we see East Africa gets a lot of NGO funding compared to West Africa, right? So there's a lot of NGO funding that just fund, work because the funders love East Africa. West Africa, not so much. So, uh, so I want to be able to build something that across West Africa, by far, we are going to be the largest um, network of diagnostics in all major cities and doing great work, seeing millions of people every year. And yeah, so that's the goal.
all right. So you want some love to come to West Africa too. That's good. That's good for all of us anyway. So thanks a lot. Thanks a lot for taking the time for speaking with us
Yeah.
today. What you're doing is really interesting, very inspirational. So I guess everyone really hopes that this is something that's going to work out because, like you said, in every African country, and particularly in West Africa, it's especially important to have this sort of network that's a bit more standardized so that whenever data is shared, it's a lot easier to share. It's a lot easier to go from one country to another to determine and analyze trends. And so it's really what the work
Yeah,
you're doing is really, really important. So thanks a lot for being here, taking the time with
yeah,
us to
thank
speak
you.
about this today. So hopefully we see
Yeah,
you
thank
again very
you.
soon
This
to
has been
talk
fun.
more.
So yeah.